Good afternoon, everyone. My name's Nicole. I'm one of the trainers here at Best Practice, joining us for our nurses session today. I guess I'd just like to thank firstly the Eastern Melbourne Primary Health Network just for organising this session. I think it's a fantastic initiative. We've got a lot of things to cover in the next couple of hours. Just quickly, I'll talk about this GoToWebinar platform. I am going to keep everyone on mute just because we do have a fair amount of participants today, and we do have a lot of content to get through. What I want to point out though is just up in the top right-hand corner in that platform, there's like a little question mark inside, like a comment box. That is like a little question section. So if you do click on that and type something in there, I will actually see that up on my screen, and sort of you can ask questions as we go through. If there's anything in particular that you want to have a look at, if we get a chance, I will keep an eye on that section as we go through. So you've got sort of that way to communicate with me. Just, I guess, on that note a little bit as well, if for some reason your computer audio's not particularly great, in this little cog, again, up in that top right-hand corner, you do have the option that you can change it to be a phone call as well. So it'll give you a number to dial and a couple of codes to put in. If you find that the computer's not quite playing ball, feel free just to change it over to be a phone call as well. This session is recorded, and we will get a link sent through so you can re-watch it as well at a later time if you need to. Alrighty, as far as content, there is a fair bit that we will cover. I have reordered this a little bit as from the website, but it is all the same content. So we'll go through how to record social and family history, as well as alcohol and smoking in there. We will go through, I guess, the consultation notes, how to use recorded lists as well. Some little time-saving things as well in there that might be helpful to you. How to record some measures and observations, keeping past history items relevant in the past history section. We'll go through how you can make sure that that's all sort of accurate and up to date. We will go through how to record immunisations, and as you probably already know, that it will automatically send that off to air anyway. Cervical screening, we will go through how to add those ones in. Enhanced primary care, we'll have a quick look through the care plans as well as the health assessments. But for the most part, they're fairly wizardy driven, but we will go through them. We will have a look in the word processor, just in case you need to sort of load a template and send that to somewhere else. And I guess the options as well that you have in there as far as sending it to those external parties. We'll have a look at the My Health record, how we can, I guess, access it firstly, but also how we can upload the shared health summaries to that as well. Managing recalls and recording contact, so we'll go through that as well as reminders. And probably if I could get some comments through that questions chat. Do you actually use Best Practice for your recalls and for your reminders, or do you actually like use a third party, maybe an online booking system or something like that to organise your reminders and recalls? If you've got an answer for that, if you could just chuck it in the questions, that just gives me a bit of an idea of who we've got in the sessions as well, if you can. And lastly, we'll have a look at some sort of extra data quality and data cleansing. There's a little bit in the database search that I want to go through. Hopefully you've been in there already. It's a fantastic tool to kind of pull out data from the database. There's a couple of utilities in BP Utilities that we'll look at, especially around making sure that any diagnoses that have been put in are coded correctly or clinically coded, and making sure that we just keep that sort of nice and clean through there. There's a few other reports as well that I'll show you that can just be sort of helpful just to make sure that sort of all that data is as, I guess, clean as possible as we go through. So that's sort of the plan of attack for today. I'm just going to jump over to my training machine and I will just open up a patient and we'll get going through here. But just remember, if you've got any questions, if there's anything in particular that you're really hoping to get out of this session, please put it in the questions, and I'll keep an eye on that as well as we go through. So this is our clinical record. You would have be very familiar with this one. You've seen it probably 1,000 times by now. First off, let's have a look at recording some social and family history. You probably know this already, but just this sort of top section up here is all a bit of a summary, and this is all information that is pulled from some other area within here. The little shortcut for it is you can actually double click on sort of anything up here, whether it be the black label or the blue sort of individual writing, and it will take you to where that information has come from. The first 3 rows here are all sort of information from the patient demographic. So if you were to sort of double click on any of that up there, it takes you to where that information is pulled through. So if you needed to make any changes to that, you could, without sort of completely hopping out of that clinical record. Family and social history and sort of alcohol and smoking is all sort of in together. It is in this clinical tree. It's got its own little section, and you do have those individual buttons that you can click on through there. If you happen to be in here, there's nothing wrong with sort of clicking into the area that you'd like to have a look at, and it brings you into this family and social history sort of window. But also up in this summary, there is occupation, but there's tobacco, alcohol, elite sports through there as well. Because it is up in this summary section up the top, you can actually just double click on it and it takes you into that same family and social history window. So either way, it gets you to the same place, just sort of depending on which one might be a little bit quicker as to where you are. Let's have a look through family first, and then, everything that we want in here, we'll just kind of go through this screen here. So family history, you do have an unknown tick box up here. You've also got no significant as well, if that's applicable. Otherwise, you do have a little bit of detail around their mother and their father. So is their mother alive? I'm just going to say yes for that one. Is their father alive? Let's say no. Age of death in here, I'll put something in, and cause of death. If you actually drop that down, there's a long list of causes of death in that. You can just use the little scrolly bar to sort of find what you're looking for. But also, because it's dropped down, you can just start typing and it will take you to what you're typing. So for example, heart attack in there, I'll select that one. Significant family history here. So we've got mother and father and some tick boxes that we can choose, I guess, of maybe some of the more common things that we'd like to record. You'll notice that when you tick these boxes here, that it actually starts populating underneath. So say I ticked diabetes here, maybe heart disease, it will just automatically start populating that box underneath. If you need to add something beyond that, so maybe a different relationship, maybe a sibling or a grandparent, or maybe it's just a different condition to what's listed here as a tick box, you can actually just click on add over here on the right hand side, and you've got a long list of relationships up the top here. You've got heaps in here that you can choose from. I'm just going to pick brother, and you've got a search list here. This is similar to that cause of death sort of drop down, where again, as soon as I start typing, it will try and find whatever it is that I'm looking for. So for example, if I start typing asthma, it will try and find that. When I do find what I'm looking for, just double click on it. It will populate that condition field there. If you needed to write any extra or other information around that specific condition, you can actually just type in that field underneath there, but otherwise just click on add and it just adds that entry into that box there. And if you needed to add more things, just go through that process again, add it, choose the relationship, find the condition. If you want to put some extra comment in, you can, otherwise just add it and it will keep populating this box here. There is this other comment down the bottom, and it is just a free text field. So if there's something that you would like to record in regards to their family that doesn't sort of fit in any of these areas, you can just type it down the bottom there as well. Social history. So we've got a few sort of drop downs in here. You've got marital status. You've got some sexuality options as well in there. This is also where you will find the elite athlete and also the breastfeeding yes and no tick boxes in here, obviously depending on the patient demographic for breastfeeding. If you were to tick yes to either of those, so elite athlete or breastfeeding, it will actually trigger an alert for the doctors if they were potentially prescribing something that goes against the anti-doping or is not particularly great for breastfeeding. It'll trigger that alert for them. You've got advanced health directive just as a yes or no. If they've got an enduring power of attorney, just as a yes or no in there. This on-screen comment here is actually referencing this comment box up the top underneath the patient's email up here. And you can use it for whatever you need to at your practice. It is just free text, so I can type sort of anything that I like in there, but it will be visible up the top. It does put it in red writing, so it does stand out a little bit, but you could just use it as a little sort of extra communication tool. Maybe they have a condition that's really important that people are well aware of, or maybe they're on a particular type of medication, again, that's really important that people are made aware of without maybe going and digging through their medications list. You could also just leave that there as a bit of a note to direct them to an area. So maybe you are hoping that people go and have a look at their past history before they kind of do anything else. So you could leave a little note in there as well if you need to. Some accommodation information through here, who they live with, if they have a carer or they are a carer, if they feel safe in their own home. If you actually hit no to that, it does give you the 1-800-RESPECT phone number and website that we can obviously pass on to the patient to try and help out there. And again, similar to that family screen, if there's something that you need to record that doesn't sort of fit, I guess, organically somewhere else, you can just type in that field at the bottom there as well. Alcohol in here, so I do have it sort of broken down into current alcohol and past alcohol in here. You've also got your little non-drinker, which just grays out that current section up the top there. But otherwise, just fill it in as you need to. I'm just going to put something in here. 5 and 5 will do. Description is just a field you can type in around their current alcohol if you need it. And then you've got your past alcohol intake as well through here if you need to fill that in. Again, a comment field. We do have an extra few buttons at the bottom of this screen though. So I'm just going to go this middle one first, standard drinks. It is purely just informational. Sometimes people don't really correlate what they're drinking to what that should be in standard drinks. So sometimes that can help them out. And then otherwise, you've got your cage questions here, and you've also got your Audit C assessment tool. So let's have a look at this one first. It's just those 4 questions. I'm just going to hit yes to everything, and I'll save that. So it's saying, okay, well, based on the answers that I chose, this patient probably has an alcohol dependency problem. Where it stores that little outcome is just in this comment field here. So it says that we ran the cage assessment on today's date, and then it's also just got that the outcome that it gave us based on the answers that we provided. So we've got that one in there. Audit C assessment tool is like a little bit more, I guess, in depth, asks us a bit more specific information. I'm just going to answer something through there. It'll generate a score. If you're actually in this screen, you can go into previous assessments to see what we've done before. There are some explanatory notes there as well if you want to have a read through them. But this score here actually will be entered into today's notes automatically. It also puts it into observations as well. So say you did this same assessment in, say, 3 or 6 months' time, you could sort of track that trend as far as how they're scoring, in comparison to each other. So that's kind of handy. I'll save that one. And the last one in here that we'll have a look at is we've got tobacco. So I'll click on here. And similar, I guess, to alcohol, it breaks it into non-smoker, ex-smoker, and smoker. And then it just sort of ungrays the pieces of information that it's looking for us to enter if it's applicable. So non-smoker, sort of nothing to fill in. If they're an ex-smoker, there's a little bit of information through here around, what that looks like. And then if they're a current smoker, we've got this little bit up the top, as well as if they would like any advice to stop down there. In this drop down here, and you probably are all over this, we do only have cigarettes, cigars, and pipe as options in there. There's definitely an enhancement request to try and get vape in there somewhere. But just for now, the workaround for that is actually just to leave that as a comment down the bottom there. And I guess on a sort of similar train of thought would be if you happen to know that a patient is a recreational drug user, again, there's not really anywhere specific to store that information. We could just type it in that comment field down there, so at least we've got a record of it. Otherwise, we can just sort of fill this in as we need to up the top. And if they would like any advice to stop, I can just make some selections through there as well. So when I save this, it will do a couple of things. One is it does update that summary up the top here. So I've got smokes 10 cigarettes a day, heavy alcohol, elite sport somehow, and then there's that red comment field up there. I'm also still in my family and social history in the clinical tree, so I can see all this extra information that was not there before. And also just back in today's notes, it does say that we have sort of updated all of those sections, and there's also that Audit C score as well that we generated. So that's, pretty much how we update that social family history. We've got alcohol and smoking in there as well. While we're in here in today's notes, let's talk a bit more about that. This seen by will be your name. You do have visit type in here. You can also change that to be one of these other options as well. You do also have the option that you can just set it as a non-visit if it's a bit more of just a note or something that you're leaving on their file. If it's not actually a visit as such, you can change that as well. Let's put that back. The visit date and the visit time will just pull through from when you opened up the file, so it's automatically pre-filled for us. The little stamper to the right of it could be important or helpful. What it does is, I'll just put my cursor down here a little bit. If I click on it, it actually goes and puts the date and time like right now into that note. So say you were doing something where it was important to note when you started or when you stopped, or maybe both, when you started and stopped doing something like an infusion or something like that. Instead of you having to manually type that, you can just put your cursor where you want it to go and just click the stamper, and then it will go ahead and put that information in there for you. You do have some options around formatting. If you really want to, you can change fonts and colors and put some dot points and things like that in there. This little ABC is a really good one as well. It will do a spell check. So it doesn't actually automatically check your spelling as you go through. But if maybe at the end of you writing all your notes in there, you just want it to maybe do a bit of a once over, just click that ABC and it'll let you know if there's anything that might need to be looked at, but otherwise this one's just pretty happy with what I've got so far, so I'll just hit OK on there. You can just type in here like normal. If you sort of want to completely type all of your notes, there's sort of nothing wrong with that. There are a few things obviously to try and help you out or make it a bit more efficient to get information in there. One of them is this sort of, it's called the history and examination panel, but over on the right-hand side, you've sort of got a whole heap of different, sections, I guess, of the body that you can choose from. I'll just have a quick look in general first. I mean, if we had to record some symptoms, there's sort of more some generic symptoms in there. Um, what this panel is doing and sort of all throughout here is, I guess, trying to make it a bit easier to collect that information. So it's a little bit of a prompt. We can sort of hit yes or no for certain things up there. It will actually then write that back into the today note for us. So we don't have to, completely write everything from scratch. You do also have sort of your OBS in here as well. And I guess the benefit of doing them through here is that it will obviously store them in observations, and we'll look at that in a little bit anyway. But it does also record it into the note as well, which can be helpful. So I'm just going to put something in here just so that we can have something, and I'll save that one. And I've just got a little bit of, so it wrote all that for me. It wrote all those symptoms or not symptoms and put my observations in there for me as well. Also in here, I mean, I would definitely just recommend, if you haven't sort of ventured too far through here, I'd definitely just go and have a bit of a look to see which ones could be helpful for you. There's obviously, our urinalysis down here, which can be helpful. You've also got, potentially if we're, doing some eyesighty sort of things, you've got a little bit through here as well that could be helpful. On some of these screens, and it's not on too many of them, maybe 2 or 3 of them, you will actually see some diagrams. I might go into this skin one because I can also choose from a whole heap of different ones. Let me pick the front of their head will do. Anytime that you do see a diagram in here, you can actually double click on it, and then it lets you sort of draw on it or annotate on it. So say if we were trying to, explain in our notes, there's something going on here, maybe, X marks the spot for something over here. Maybe, there's been a bit of a biopsy taken from there. I don't know, maybe they've got a bit of a rash or something going on over here. Whatever it might be, you can sort of, use all these tools down here, the colors and things, draw on that little image. What it does is it puts that diagram into our today's notes. And then beyond that, you can sort of, type, the pink is, a rash, the red circle means something or other, and, sort of update your notes. So I'll just make them a bit smaller. That's an awfully big head in my today's notes. I'll make that a bit smaller. So that's definitely a little bit easier potentially to get some information through there. If you haven't looked already, definitely go and have a look. There'll be areas that you'll find sort of definitely a lot more useful than others, but just have a look in there as to what's going to work for you. Also, from, I guess, a time saving perspective, there are autofills or like shortcuts. What they are, if you haven't come across them yet, is you can set up to put in a particular combination of keys, and you can get the software to recognize that that combination actually means something else. So, I only wrote EXX then, and now I've got this big, massive checklist that I can go through and fill in. These are really helpful, especially if you are doing I guess maybe some more of those repetitive type things where you have a bit of a checklist going on, and there's really just some places that you need to, put that specific individual information in. And what I've got in here are those little up arrows. They're called carets. It's above the 6 on the keyboard. But what they are kind of like placeholders for information. So all of this text is all fairly generic, except it's then asking me to sort of fill in the bit that would be specific to, this particular patient. I can just use my mouse to kind of go through. The only thing with that is that actually is a little bit not hard, but it is a lot of sort of a bit of concentration for me to click in the right spot there. But also I would then sort of have to backspace and then go ahead and type something in there, which is possibly not the most efficient way. If you do have these shortcuts though, and they do have that little placeholder, that up arrow, you can actually hit Shift and F5 on your keyboard, and see how it's purely taking me to that particular symbol. So that can be a lot quicker just to take me to the next section, and then I can, fill in the piece of information that I need to. So I might say, I don't know, 5 in there. I'll go Shift F5, remove them in 7 days, Shift F5, I don't know, send it to the lab, whatever it might be. How do you create these shortcuts? Fantastic question. In this little autofill button down the bottom here. So you can make whatever you would like that's going to make your role a lot quicker in here, or a bit of a checklist through there. Just click into that autofill down the bottom. I've got those ones. There's that EXX one that we were just playing with, but I can click on add, and in here is where you type what you want that sort of expanded text to be. You do have some formatting as well in here. I have seen some pretty sort of intricate autofills at different practices. So, again, this is all just to make your role a bit easier, that you can sort of pre-fill it as you need to. I'm just going to put something in here. I'll just say that the patient presented with flu-like symptoms. Probably not so much a good example for us, but you could do maybe like a immunization one or something like that. I just want to put something in here. I am going to put some up arrows because they would be, remember, those placeholders for information. And I'll just put other in there as well. So whatever you want that expanded text to be, just type it in that top box there. The shortcut, just be a little bit mindful around what shortcut you enter or what sort of word you put in here for your shortcut. Because remember, it's as soon as you type that and then put a space, it knows then to change it to be this full text. Flu is not a very good example, because how often potentially would people be typing flu? You could put things like a hash, an asterisk, full stop, exclamation mark, a Z, something where you know specifically that that's exactly what you're looking for when you type that particular code. Available to all the users. You don't have to always share your autofills or your shortcuts. You can just have some that are purely for you. And again, from a time-saving perspective, if there are even sentences or maybe a couple of sentences that you are very regularly having to type, it makes complete sense to add them as an autofill, assign them, a few letter combination, and then instead of having to type that sentence or couple of sentences every time, you can just put that shortcut key in and it will insert that code. Let me go hash flu, and it expands it out. Again, I've got those little placeholders, so I can go Shift and F5 and it'll take me through all of them. No, yes, no, whatever it might be. Brittany, your question, we have a lot of autofills for the GPs. If I delete some, they won't delete from all the users. They will, especially if they are ones that are shared between people. So yeah, just be a little bit mindful if you are doing a bit of a cleanup that they're not ones that other people are wanting to use, or if they are sort of older ones that maybe 1 or 2 people are using, they could go in and essentially copy it, but make it only available for them, not available for everyone, just to kind of clean that up if you need to. That's autofills, but definitely if you can, make the most of that as far as from a bit of a checklisty point of view, to make sure that we are sort of recording all the information that you need to, without having to type that whole big checklist. And also from if there's the sentence or couple of sentences that you're writing regularly, just so that you don't have to keep typing that all of the time. Some other buttons just down here. We will have a look at diagnosis. I know it's more of a doctor thing, obviously, except if we've got some nurse practitioners. Diagnosis, again, similar to that cause of death, and even when we're adding the family history, when we start typing in this search, it will then try and find whatever that is that we're looking for. So again, I'm just gonna keep on the same train. I'll look for asthma again. So start typing it. When you found it, just double click on it and it adds it to the box over here on the right. And this is probably a good little note, I guess, to understand, I guess, where all this data goes to and gets stored. This diagnosis list here is clinically coded. So when we double click on it, we're saying that we are choosing that clinically coded version of asthma. Where we kind of fall down a little bit sometimes is because it just populates over here on the right hand side. If we kind of touch that field, as in if we, go and put some extra information in there, or we, maybe put a question mark for a provisional diagnosis, or basically if we touch that in some way, it actually changes it to not be clinically coded anymore, which then means that we need to go and clean it up at a later date just to make sure our data is clean. And we will go through that process, more towards the end of the session where we have a look at cleaning up data. But if we can avoid it in the first place, the goal would be to find what we're looking for, double click on it, just not touch that field up there. And if we can get the doctors to not touch that field as well, that would be great. From a data perspective, there are some tick boxes through here, quite welcome to use those ones. Depending on what we choose, it will sort of ungray things that are relevant to that particular thing. I'll just say severe there. There's a provisional diagnosis tick box there. And if they still need to type more about that diagnosis, they can type a whole story down here in the further details, and it will not affect that clinically coded item. So they could put, severe, it might be whatever that they're typing down there. But if they can just double click the diagnosis and sort of just, I guess, ignore that field, then they can type down there. That will make our lives a bit easier as far as cleaning up that data later. There are some tick boxes in here, so adding it to the past history, if it's an active or inactive diagnosis, saving it as a reason for visit is typically ticked by default, but they can untick that if they like, including in summaries, sending it to My Health Record. If they don't want that, they just simply untick it and save it, and that's sort of the flag that it's set. I'll save that one. That is automatically adding it as a reason for visit in here. If that was, potentially a mistake, like if we do end up with a few reasons for visit in there, you can actually right click on it up the top here and you can delete it if you need to, if it was sort of put in there on accident. We will have a quick look through procedures. Similar kind of concept, except obviously we're talking procedural related items. So things like, biopsies and excisions and injections, things like that. I'm just going to put something in here. So I'll go biopsy of the skin. Again, it is just helpful to sort of get in the right habit of maybe, not that these are necessarily clinically coded, but just to get in that sort of same pattern. If we want to put some extra information, type it down here in the further details. Again, you've got sort of similar tick boxes through here as well if you need them. I'll save that one. And you've also got a reason for visit potentially. These ones are a bit more of the generic reasons for visit. By default, it will show us the previous reasons just for this patient. So, Bonnie previously came for all of these reasons. So if it is just something that they're regularly coming to see us for, we could, just double click on it there, save it, or go ahead and add another one, and it will just save it through there. It does also have a lot of more generic reasons for visit as well if we need them. So for example, there's, all sorts of pain versions in there. There's, if they're seeing the doctor for a medical certificate, an exam, a care plan, whatever it might be, just do a bit of a search in there, find what you're looking for, double click on it, save it, and it will just put it in there as a reason for visit as well. Past visits down here, if you need it, it just puts all of their past visits in sort of one document that you can have a look at if you need it. It does put it in its own little window, which can be helpful, if you sort of needed to sort of have a look at something over here whilst also sort of doing something in the main screen, you can do that. I'll hop out of there. You've also got the last visit as well down here, which will just take us to whatever that last visit is. It does take us out of today's notes and puts us in this past visits here. I'll just click back into there. So past visits is obviously just all of the past visits. If you needed to, you can just double click on something and go and have a bit of a look through there. There is also a little bit of filtering up the top, because sometimes there's lots of visits in here. So if you're just filtering for a particular reason, you can do that. It just kind of shortlists that view. You've also got, maybe you just want to see when they saw a particular provider, not all of them. You could potentially look at that as well. There is also this search which can be really helpful. What it does is, I'll just put a word in there, or not quite the start of a word. What it'll do is it'll go and try and find that um, anywhere within the consult note. So it doesn't have to be the reason for visit, like these ones would be diabetes, but it could just be something that's written in that note. So these red ones are all the notes where that DIA is somewhere in there. Let's have a look at this one. Oh, there we go, diagnostic down the bottom there. So if you're looking for a particular keyword or something like that, and you can't sort of easily find what you're looking for, that search can be really helpful. Probably the only other one in here I'll just point out is this tick box, hide non-visits. Remember back when I said in our today's notes, if it wasn't an actual, I guess, proper visit as such, you can come and always type in just what's called a non-visit as a bit of a note. If that's ticked back here though, that hide non-visits, any of those notes you wouldn't see in the list. So say if you were recording, faxing a referral letter to a specialist or something, and you just put in there as a bit of a non-visit note, just so that everyone knows we've done it. If that's ticked, you wouldn't see that. You do just need to untick it, and then it will show all sort of the proper visits, I guess, as well as all the non-visits as well, just with that tick box there, which can be helpful if you're sort of looking like, oh, I can't find, I knew I wrote a note in there, I just can't see it. It's probably just because that one's ticked. Just untick it and you'll see the extra things in there. That's pretty much today's notes. If we keep talking around just observations briefly, so they were just back in general, if you were sort of in here already. You do obviously have your observations in the clinical tree as well, so I'll click on that one. They're those ones that we just put in earlier. So I've got those sort of few obs as well as my audit C score. I apologise for my left-hand side here. It's just because I've got my screen zoomed for training. Yours should look normal over there. It just doesn't quite match up for me at the moment. But you do have your observations in here. You can also put multiple observations in if you needed to. That functionality has been in here for a little while now, the last few versions at least, we have been able to put in multiple observations. Handy for, say you've got a patient that you're waiting for the ambulance for, maybe you're sort of monitoring maybe their blood pressure or whatever it might be every 10 minutes or so. Before we would sort of have to either manually keep that or sort of just have one record in here, but now we can actually go ahead and add a multiple or a second or a third in here. So I've already got those observations from earlier. I'm just going to click on add. It does say, hey, you've already got some. So do you want to edit them or would you like to create your own? So I don't want to edit it. I'm going to say no, and I'm going to go and create a whole second observation. And it could still be, on the same thing. It could be something different. I don't know. I'll just put something in here and I'll save that. So now I've got 2 columns, same date, but just those 2 separate times in there. All those other ones where there is just the one, obviously it just has the date, but as soon as we have multiple, it will give us the time. So we can kind of see maybe it was, 12:40 and then we did it again at 12:50, 1 o'clock, whatever it might be. You can always graph your observations as well if you need to. Maybe I have blood pressure up here, and you can print it as well from there if you really want to, but we can sort of track it through here. The next thing on my list, so keeping the past history items relevant. So any of those past history items, there is that whole past history section in the clinical tree. So I've got a few sort of bits and pieces in here. I've got the top half of my active problems, and then I've got some inactive problems down here as well. And you've got some columns as well, just to kind of give you a bit of an idea of sort of what's going on. So, is this particular item being included in summaries, yes or no? Has it been marked as confidential, which means only sort of that person who entered it can see it unless, we sort of have a higher priority or permission to see it, or maybe we're doing an export for a subpoena or something like that. If we said yes or no to include it for My Health Record, you can kind of see all that information here. If, say, you came in here and you knew that, I don't know, their high blood pressure is no longer active problem, it sort of, has, fixed itself, they're on medication, whatever it might be, you can actually either select it and come up here to edit, or you can right click, it does the same thing. And you can either edit it, or even when you right click, you can actually just instantly mark it as inactive, and it essentially just picks it up and moves it down to the bottom there. You can right click and edit, and you do have that same sort of option in here, whether it's active or inactive, so just depending on which way, but right clicking it and marking as inactive would be the quickest way to move things if you needed to. Same as if you had an inactive problem that maybe was down there by accident, it should be an active problem. You can just right click again and mark it as active, and it just kind of shifts it up again. Let's move on a little bit, and let's have a look at immunisations. So immunisations, again, has its own little section in the clinical tree. We do have the option where we can sort of completely hook into AIR. So I'm just going to click my View AIR button here. Let it go and have that conversation with AIR. Obviously, Bonnie's not a real person, so this takes probably a little bit longer, hopefully, than it takes on your end. But it will always take you to this general tab. And in here, it will show you if they've got any alerts, but also if they have any vaccines due. It will show you that at the bottom there as well. Beyond that, their history. So this is obviously their history according to AIR. And I mean, they've got heaps of stuff entered, but I've only got the one in my data. You can actually right click on any of these entries, and you can actually save it back to best practice and save it to the patient record. So then we get that second entry here, and it just says that it was not given here. So it wasn't, part of someone at our practice that gave it to them. And we can see that little AIR status says success. So we know that it's essentially been downloaded by AIR that way. And you can download as many of these as you need to, so that sort of we have that accurate record back here. Getting the individual immunisation history statement, I won't click on that one. It takes a while to generate for my Bonnie, but it is the green sort of backgrounded Medicare one that sort of lists all of their immunisation history if you needed to print that out for them maybe. Medical contraindications, so you can actually see if there are any medical contraindications listed at AIR for this patient, so you can kind of see all that information through here. You can also see if they have any natural immunity listed in here as well. You can also add to both of those. So if you had a medical contraindication or a natural immunity that you needed to add, just click on this add medical exemption down the bottom here, and it's the same screen for both, but it just sort of grays out the bits that it doesn't need you to fill in. So just sort of instinctively follow it down. Contraindication, we get to choose whichever one it is that we're talking about. I'm just going to pick one up the top. Is it permanent? Is it temporary? And then depending on what we select, it ungrays the field or fields that it wants us to fill in. So permanent is whichever one of those. If it's temporary, what's the reason? What's the end date? Natural immunity, you can only choose from these diseases. And again, it's asking you to fill in sort of those two dates. When you click save and send, it will then send that data directly off to AIR. So obviously it'll update their record for other people that have a look as well. Pop out of there. Vaccine trials you can't add to through here, but you will be able to see if this particular patient is part of any Department of Health approved vaccine trials. You'll see that in here, just so you've got that record. I'll hop out of there. You can filter by disease. I think this is a sort of a newer feature, not sort of brand new. It's been there for a while now. But you can also filter again if this big long list is in there. If you just want to narrow it down a little bit to particular ones, you can if it makes your life a little bit easier, but I'll just leave that back at all. Stephanie's just asked, can medical contraindications be added by nurses or just by doctors? That's a really good question, and I'm not 100% sure. So I'm just going to write that down, and I will clarify that for you. And I'll put that in the follow-up email so you get an answer for that one. But that's a fantastic question. Thanks, Stephanie. Adding an immunization in, you've just got your add button up here. And just go and find whatever vaccine it is that we're giving them. Again, I'm just going to pick something up the top. Billing provider, whatever that needs to be, whether it be, the doctor or the practice, whatever it needs to be. You do have these two, which potentially can be helpful. If you've got someone from overseas, we can still record that information. We can just say that it was given overseas. Means this gets grayed out because it's not something that we're physically giving them. And then we can go ahead and choose what country it is and some dates as well. You do also have that not given here. Again, if they've provided some documentation, you can come in here and sort of add it without it being something necessarily that we're physically giving them. I will just change that back. Given by will be your name in here if you're the one that's actually coming in here. That date there will default to today's date, but if you needed to, you can always backdate that if you had to. The route, where we're putting it, just make a selection through there. You do have your batch number, and if it's not the first one out of the batch, you'll typically have it in the drop down. I obviously don't have anything in mine, so I'm just going to put something in there. If, say, this was the first one of that batch, so we could put the batch number in, we can choose the expiry date. I'll just make it in the future there. And you can actually save those batch details on the fly, which just means that next time I come in here and I give this particular vaccine, that A1234 is already going to be in the drop down for me, which can be a bit of a time-saving thing. Vaccine type here, this is all to do with those mandatory AIR reporting changes. I think they were back in March. So you've got some options in here to choose from. And you can put a comment if you wanted to. It will automatically be sending this to AIR. If for some reason you don't want that, you can just untick it for that particular immunisation if you need to. But otherwise, just click on save. What it does now when you do click on save, because of this extra reporting data that AIR needs, if for some reason that's maybe not the right one, obviously according to their criteria, it will then just kind of cross-match it and look at it. And if it sort of has any issues with it not meeting that reporting requirement, it will give you a little window and it tells you sort of which piece of information is not correct. So you can obviously go and fix it up. And then we still have the option that we can then, after we fixed it, keep going forward and sending that information off to AIR. Sometimes you will see a message like this one. It's not necessarily a bad thing. It's just that this particular patient can't be found on AIR's end. And for me, it's because Bonnie is not a real person. But for you, it could be maybe they just don't have an AIR record for us to add directly into. What this essentially though is asking you is, are you sure that the information that you have entered is correct? And if it is, all you need to do is say yes. It'll still send that information to AIR with all of that information. All it means is that on AIR's end, they actually have a person who looks at it and sort of manually allocates it to the correct patient if it can be, essentially. So it still sends it successfully. It just means a little bit of extra work on the AIR end just to make sure that it is sort of allocated to the correct patient. But in here we can see, today's date was successfully sent to AIR through there. Children are a little bit different, only slightly differently. Let me just go and quickly find a child. I'm going to go Ben here, so he's 4. With the children, they do have exactly all of the same functionality that we just went through. Their extra bit that they have is that they have their schedule over here as part of that immunisations section. So it does make it a little bit easier, because if we were just giving them one of these vaccines off their schedule, all we need to do is click on it, and this is the same window that we were just looking at, except it shortlists it to be which one, depending on obviously what we're giving them. So it doesn't give us that big long list. It says, okay, well, if we're giving them their diphtheria, tetanus, etc., which one of these is it? So then pick one and fill this in obviously exactly as you normally would for the adults. So just the kids get that little bit of extra for their schedule. And it is looking at their demographic as well. So for example, Ben here doesn't have an ethnicity recorded for whatever reason. Maybe that's an error. If I actually go and update that to what it should be, so in here, maybe it should be, Aboriginal but not Torres Strait Islander. When I save that and just come back into immunisations, that screen has now updated, obviously based on that ethnicity. And again, I apologise, just because my screen is zoomed, it's sort of zoomed the 4 years off, but yours will look fine through there. So again, just pick the one that you're giving them and sort of follow that same process that we were looking at before. I'll go back to Bonnie here. Does anyone have any questions at all so far? I know that there's been sort of a couple put in that questions. If I haven't talked about it yet, I will circle back to it. It'll probably be that I'll talk about it somewhere later. So if you have put something in there that I haven't said anything about, don't stress just yet. I will talk about, I'll go through all of them at the end and make sure we cover off on everything. I'm just going back, sorry, quickly and reading one from Stephanie. Is there a better way to configure the opening screen in BP for nurses, or is BP opening screen the same for everyone? Checking because MD has a preferred option so they can see a range of info at a glance instead of opening into meds. That's a good question, Stephanie, and I guess the answer is maybe. As far as what this screen looks like when you open it up for a patient, I mean, ultimately the information here is the same regardless of whether they're a nurse or whether they're the doctor. The only thing that you can sort of customize would be a preference. So if we just go back to this main screen, up in setup, there's preferences. And even if you sort of typically all users will have access to edit their own preferences, because it's not about what you can and can't access, it's more about how you use the software. In here though, there's a few things, there's lots of stuff in here, but just more to do with your question as far as where you open up a patient into. Potentially you might want to change. I mean, they're the only options that you have, but potentially you could change it to one of those if it was something that you sort of didn't utilize normally. You sort of got those options in there, if that answers that question at all. Let's come back out here. Let's keep going through our list of things to talk about. Let's have a look through for our screening. It does have its own little section in the tree here. So you will be able to see, I've got a pap smear in here. I don't have any other tests through there as well. As far as adding something in here, again, it is fairly intuitive. You just need to come up, click on add, and basically fill this in as you clinically need to. So the date that that was performed, who it was performed by, and you do have those sort of other options if it wasn't performed sort of by you. You've got that option there. If it's potentially, I don't think I have any, oh, I do have, sorry, I didn't know I had any inactive providers. Oh no, I don't. No, do I? Sorry, I'm confusing myself now. I do have someone in there. If, say, this was requested by a doctor who's now left, you could still include them in that list here so that you can put that data in correctly. Whichever one it is, if it's unsatisfactory, if any of these have been detected or not detected, obviously just choose what you need to through there. You do have your LBC result in there, so just make a selection. You've got some risk category as well if that's relevant, and other comment that you can type in. From here as well, if say they needed to do this again in 6-12 months, you can actually go ahead and create that clinical reminder through here sort of as you're adding this this entry in. So just add a reminder. We'll quickly go through this just so that you know sort of that functionality, just in case you haven't done it before. This will be a full list of their reminders. You can just come in here and click on new. I've already got one up there, but anyway, I'll go new. A big long list of the reasons that we can choose for our clinical reminders. This list as well is sort of practice specific. So if you want something in the list that's not already there, just have a chat to your practice manager because it can be added. It's not like a hard-coded software list. Choose whatever it is that you're looking for in here. Maybe it's this one. If though you can't find what you are looking for in the list, you do have the option that you can type in there. But if you can choose from the list, that's the ideal way to go first, if you can. Because this one for me is set up for every 5 years, it has already automatically selected a date 5 years from today. You could change that though. So say if it is something that we wanted to do in maybe 1 year's time instead, you could make that change over there. If it's even more urgent, we could do it in 3 months or 6 months, whatever it might be. Depending on sort of what reminder you're putting in, you could even put it as a very specific date. It doesn't have to be sort of one of those intervals. We could say, the 1st of the 8th this year, if you wanted to or needed to. You do have the option to put some reminder comments in down here. So it does give you the red warning to say, hey, that these will not be communicated to the patient. So anything that you type in here is purely just an internal note if you need to, but otherwise you can just save it. I won't save that, I'll just cancel that. but it will obviously add an entry through there. You do have those couple as well, if that's necessarily. What those sort of help to trigger with is you would have seen just up in this notification section, there are a fair few preventative health options potentially that you might see and hear of things depending on the patient demographic, their past history. Obviously we've got some screening through here. It will sort of try and be helpful if there's something that potentially should be looked at that hasn't sort of got some entry somewhere. These ones will sort of play into whether it's telling us up here that something is due. Obviously, if they don't need to be doing it anymore, then it knows to not sort of put that in as a preventative health reminder for us. That's pretty much that. Let's have a look at the enhanced primary care, so some care plans and health assessments. Michaela, just going back to your question from before. So Michaela says, just wondering if you might please know where the work cover templates are within the enhanced primary care plan templates. Can you give me a little bit more information on what you mean for that? And I'll just keep an eye on that questions if you can put a bit more info in that. But we will come down and have a look at enhanced primary care. It would be interesting actually as well to know if at your practice, are you doing let's talk care plans. Are you doing your care plans through this enhanced primary care section? I think there's actually a reactions button somewhere or a hands up button. If you are using care or creating your care plans through this enhanced primary care, could you put your hand up or give me a little reaction just to see if how many a thumbs down? That's confusing for me, Nicole, if that's there's a few thumbs down. I don't know if thumbs down means thumbs up or thumbs down is a no. Some yes, some no. Yeah, cool. There's still a few, which is interesting. I know typically from a training perspective, I guess the con of not doing it through this module, even though it's probably potentially easier to do or simpler to do, is ultimately what that document looks like at the end of it. And yeah, I know that sort of some people aren't always I guess happy with what information is in that final document, or they want to put extra information in there, in which case, we sort of have to go through the word processor and not through here. But let's have a look at both. So in this enhanced primary care, there's obviously a few other ones. We're just going to have a look at care plans and health assessments today though, because again, for the most part, it is just fairly wizardy type driven, follow your instincts through there. If it needs extra tick box or something for consent maybe, or something like that, it'll ask you if you haven't done it. It sort of leads you in the right direction. Let's have a look at care plans though. I'm going to add a new one, and I'm not going to preload it just so it has a blank slate, just so we can kind of see what that looks like. Go okay there. It would obviously pull through from their previous if I did choose to preload it. But in here is sort of these three boxes ultimately that we need to fill in. So whatever that problem is that we're doing the care plan for. So I'm just going to click on problem. So we can enter a problem or we can select from the list. So, if it was, say, one of their previous problems or conditions, we can do that. We can also go and search for a new condition as well if we needed to. I'm just going to choose asthma there. It does also say, just in case you missed it, if you had multiple things, maybe not so much on this screen, but maybe when we're talking about goals and tasks, if you do want to add multiple things at once, using the control, if you hold down control, you can sort of just cherry pick the ones that you want, whereas holding down shift will obviously select everything in between the two that you select. So control just lets you sort of pick individual ones that you need to, whereas shift will let you sort of everything between the first and the last one that you click. I'll just hop out of there. And in the goal here, thanks, Michaela, that's okay. In the goal here, obviously we can come in here again, we can just type in that box, but you do also have a big long list of ones that you can choose from. And again, this list can be customized at your practice as well. So if you are putting in a goal that's maybe not in this list by default, just have a chat to your practice manager because they can update this list to be what you want it to be, because the less that we type, obviously the more efficient that process is going to be. So if you can't find it, get them to add it, but in the interim, just to get this care plan through, you can just type in there. Otherwise you can sort of pick, again, I was just control to sort of cherry pick ones, or you can do shift, same as before. So I'll add those ones in there. The tasks, so in here, we can again type or choose, and that list as well is customizable at your practice. So whatever it might be, let's say arrange transport, who is responsible for that task, and you've got your due date as well down there. So it might be, yep, that's the patient to sort after or to look after. Maybe it's, by whatever date, and maybe we then or I don't know, arrange a walking aid, and that's going to be a nurse that's responsible to do that by the weekend, whatever it might be. You can always go and make, or not make, but add them as external. So let's just say, I don't know, a dietary review, and we can pick an external provider. When you come in here, hopefully your screen looks like mine, but I'll just explain it because again, it is a preference if it's been sort of set up. This top half here is talking about your local directory. So this essentially is your best practice address book of any of your contacts that have been entered. What my screen does is that's my top half, but then I've also got the HealthLink online directory at the bottom. So whenever I do a search for, sorry, let me type something else in there. So whenever I do a search for something up here, it's already looked through my local address book, but it's also, these are all my, my HealthLink as well. And also in here, potentially, you could narrow that down a bit to be, okay, well, just show me the dietitians, or show me, whatever category of thing or, contact that we're looking for. You can make some selections as well through there. Also down here, if you're looking for ones in a particular suburb or something like that, and you sort of can pick either or as far as who's going to be responsible for that task. I'll just pick Dr. Atherton up the top there. So I have that one. You've got some other comments down here, performed by whoever. Obviously, that will be the doctor. We would typically be saving them, and then obviously the doctor will finalise it when they see that patient. If you do want to have a look at what the document will look like so far, you can preview down here, and it just takes you to what that looks like. And this was sort of what I alluded to before, that, it is a fairly, basic document. If the doctors are wanting extra things in here or something like that, you can't edit what this document looks like. It just is what it is. So if that's the case, we would need to go through the full-blown word processor and do care plans through there. So I've added there. If you are doing care plans through here, you can also, again, at your practice level, set up some like templates for them. So I think I've got some in here. I'll just click that. Okay, cool. So I do have some templates already pre-configured. If I were to select them, I'll just choose asthma again. It will then go and add the problem, add the goal, add the task according to the template that's been set up, which again is significantly quicker as a starting point than you having to go in here and do it completely from scratch. even though you've loaded that template, doesn't mean you're stuck to that template. So say it added, some of these in there, and that's not something that we need to do. You can just still come back into goals. Oops, sorry, actually, to get rid of it, just right click on it and delete it. Yeah, I'll delete that, that's fine. If you loaded the template and it didn't give you all of the ones that you wanted, just go back into goals and add the extra ones in. And same thing through here. If, this was not something that we needed, just right click on it and delete it for this particular care plan. So even though you load from a template, you're not sort of stuck into that template. You can still choose what you need to through there. I won't save that one. Health assessments, just quickly while we're in here as well. I don't meet the criteria, but let me just go and update this so that I will. And I'll come back. There we go. So health assessment does pull through most of the information that you'll need in here. We do need to get consent for health assessment. I'm just going to preempt that because I typically forget, and when I go to preview it, it reminds me that I haven't got consent. So I'm just going to do that now. You can put in a location as well in there if you need to. So demographics, it pulls through all of that from their demographic. Their family history, that's that family screen that we looked at the start, so it pulls all that through. Social history pulls that through. Alcohol, tobacco, their medical history, it pulls that. So there's their past history and their immunisation history. Again, pulls all that from their clinical record. Medications, it'll load that through. History and examination is just our note from today. Basic functions and activities of daily living are pretty much the only two that you'd need to sort of come and enter some information in. So we've got, I'm not going to do this properly at all. I'm just going to tick some things. You've got some hearing, vision, teeth, other bits and pieces through here that you can fill in, and some, I guess, extra things as well, buttons that you can click on through there. Activities of daily living, similar sort of concept where you just need to select what you need to. Again, I'm just going to tick something through here so I have something when we look at the document. And then when you're finished, you can preview it to see what it looks like. And again, it just puts it in that document at the end of it. So all that information that it pulls through, as well as all our bits and pieces, our alcohol, our past history, all of that. This is those extra ones that I sort of hit yes or no to as I filled them in. Anything that I didn't fill in, that's why these ones are all blank, because I didn't quite click next to those ones. And you've got all of those activities of daily living as well through there. If you put in the consult note, there was that little tick box at the end there that you could not include that if you wanted to. And then obviously we've got some signatures at the bottom. So again, this is the template, or this is the document that it generates at the end of it. If the doctors aren't happy with that and they want extra things, or it to be laid out differently or to look differently, it just means that you will need to then do your health assessments through the word processor. You won't be able to do them through here if you need to edit that document or the layout or what's in it in any way. How about it there? And I'm not going to save that one either. There's just that little tick box for save examination notes. Oh, sorry, save examination as today's notes if you need to do that one. Oh, better there. So that's enhanced primary care through here, if that's sort of how you do them. The other way is through the word processor, which is also all your other templates and letters and things through there. So I'm just going to come up to the white piece of paper up here. And this is our word processor. You do have your favorites down here on the left. And if you do have sort of a handful of documents that you are using regularly, I would definitely be adding them to your favorites, because it is a fair amount quicker to load a template from here Otherwise, to go sort of the long way, and what you'd do if it was just like a once-off document, is that you would actually come up to templates and you would use a template, but then you need to go and find it through the big long list of supplied templates, as well as any of your custom practice templates will be in here as well, which is just time consuming. Even though you can kind of click in here and again sort of start typing to try and find something, which speeds it up a little bit. But if you were using something regularly, for example, if you do your care plans or health assessments through here, definitely add them as a favorite. If you need to do that, just come down here and click on add. It takes us to that same screen, but in here, all we're doing is finding it once to add it to our favorites, and then we can use it after that. All of them, if you're just looking at your practice-specific customized ones, they'll be in that custom list here. Supplied ones are just supplied with the software. You do also have that include all states, which may not be sort of necessary for adding a favorite, but just using a template. If you're sort of, I guess, on the cusp of state lines, and maybe you see a patient that comes from the other state, all these supplied documents are for your state specifically. Sometimes you might need a different state's version of that same document. If that's the case, just include all the states and then see how it does. That's the same document essentially, but just the different states. It then gives you that option that you can pick the right state. I'll hop out of there. Actually, no, I do want to add something through there. Let me just add a care plan as an example. So that was purely just adding it as a favorite. As far as then using one of those, you can actually come into care plan here and just double click on it. It then generates that document. It takes that template, it puts it with all the data that it's asking for from the clinical record, from the patient demographic, and it spits it out into that document. This is then still just like a Word document to a degree, even though it has pulled this information through from the database somewhere. It is still now just in text. So if you wanted to get rid of particular things, you can highlight things, you can remove them, you can type. Oops, if I go type properly, you can type some extra information in there. You can, change all of this if you wanted to, make it a bit bigger, whatever you need to do. This is now just a document that you can work with, and you can enter extra information in there if you need to. If you wanted to or needed to add extra information from the database, that wasn't just naturally part of the template, what you can do is put your cursor, I think that's the end. Oh no, this is the end down here. I'm going to go right to the very bottom. I'm just going to make a new page. Put your cursor where you want that information to go. You then have sort of these groupings over here. So most of them you're probably not going to use. The two big ones that you'll want to pull information from, one is patient, which is all just the patient demographic. So, think names, addresses, next of kin, phone numbers, Medicare number, all of that sort of thing. The other one is the clinical record. So that's, all of that past history, their medications list, their urinalysis is in there, their reasons for visit, their cervical screening, things like that. If you do want to insert any of that extra information to save you having to type it in, you just need to put your cursor where you want it to go, similar to today's notes, and then just come over here and double click on whatever it is that we're looking for. Let's say smoking history. And it then just goes and populates that with that information that we entered earlier, which is a bit quicker than us having to type it in. Just thinking still as far as using any of these templates in here, it doesn't, maybe not so much a care plan, and this is probably not so much something that you would do, but just to make sure that you're doctors maybe are aware of it, especially if they're sending referral letters off. There is this option under the clinical grouping for investigation reports, and it's really helpful. Again, put your cursor where you want it to go. But what you can do is actually insert a result for that patient as part of that letter. So say we wanted, I don't know, one of these or multiple of them, you can choose more than one, that result to be in the document. You can insert that directly through that investigations report. So you have it here. And again, it's now just text. So if you don't want that heading, you can just select it and get rid of it. If you don't want to include half of that, just the important ones, again, it's just all text. You could then go and, highlight some extra ones or change some colors. It's just then a Word document that you can play with. Once you have sort of done your documents in here, whether it be a care plan or some other letter that you're creating, you can save them. And probably if it was a care plan, you'd maybe be saving it as a draft, because then the doctor can pick it up and finalize it as part of their process. Otherwise, we can obviously just save it down here. You can print documents from in here as well. You can email documents from in here if you wanted to. So if I clicked on, obviously providing that the practice has got their outgoing email set up, but if you've got the @ symbol, it means it's been set up. You can email that document. I'm just going to pick my patient's email address. If this was, say, a document that was addressed to a third party, it would automatically load that third party's email address in here to obviously save a little bit of time. The subject will be the template name with the patient name, but you can override that if you want it to be a very specific name. You can do that as well. It will by default put a pin on the document, because obviously there's sensitive information here, and your practice may also have the policy not to email. Obviously, stick with that, but just functionality wise, it is there. The pin does default to the patient's day, month of their date of birth. So it means that this document will be a PDF attachment to the email. If that's turned on, the patient then needs to enter that code, otherwise they won't be able to access that document. And you can send it, it'll go and email it off. The other option as far as sending documents as well, and may or may not be useful for you, but it's super quick to show you just so you know what functionality is there, is again, if you are sending a document to a third party, you do have the option that you could, providing the third party accepts it that way, you can send it using secure messaging. So if you've got, like a Medical Objects or Argus or HealthLink or one of those other third party secure messaging providers set up, if you just click on that little paper tray, it will then go and put it in that HL7 format. If I pick someone to choose to send it to, and it goes and puts it in a folder, that third party tool picks it up from the folder and securely messages it to wherever I need it to go. So you've got sort of those few options as far as, getting that document out of the software. I'm gonna hop out of there. So yeah, if you need to write any documents, if you do your care plans and health assessments through there, it's just a bit of white paper up the top to take you to that word processor. Next on our list, just My Health Record, accessing and uploading. So My Health Record does have its own little section up in the menus along the top there. So you do have the option there that you can view a document list. It'll obviously go and connect to their health record, and it should, there we go, bring us a list through here. So you can double click on them and have a look as you need to. There's a few sort of tick boxes and things through here as well if you're looking for particular documents that may not be listed by default. You can sort of make some changes through there as well if you need to. There is a notification potentially that you'll see in here, which is just this shared health summary. If you see that, it means that a shared health summary hasn't been uploaded for this patient in the last 12 months or the last year. And it is just a bit of a reminder for the doctors to potentially upload that so that it counts towards our PIP and things like that. You do need to have a health identifier in your user record for you to be able to upload a shared health summary. So again, may not be something that you can do, but I'll just quickly show you how to do it so that we can make sure that the doctors are entering and uploading that that data efficiently. So up in my health record, there's this create shared health summary. It does sort of pull through from those areas. See that? Hang on, I'll just fix up my allergies that it was whinging at me about. Try that again. So we've got this. When they preview the document, and this is probably where the doctors get unstuck a little bit, because what it does is it puts all that information in a document in this shared health summary. It hasn't uploaded that yet. They actually then need to click on this upload button down the bottom. That's when it goes and sends that document off to their health record. Sometimes we sort of get to here and go, oh, yep, that looks fine. It's all uploaded. And they sort of hop out of here without clicking on that upload button. So that's just something to be a little bit mindful of to potentially help them out to make sure they're clicking upload. I'm just looking at the list of things that we need to cover. Michaela, I just saw your message saying that you're not connected to AIR. Typically what that will be is, so the doctors access AIR through their provider number, which is listed in their user record, essentially in the software. What we would do for nurses is there's actually a location AIR provider number that you can get from Services Australia. It's a document to fill in. I'll send you a link to it in the follow-up just so you've got it, just in case that's what's going on. But that location AIR provider number would then allow sort of anyone who doesn't have an individual provider to be able to access AIR. And once you've filled in that form and Services Australia give you that number, it does just need to go into set up practice details. In the location, there's that AIR provider number. So that number they give you just needs to go in here, and then that should allow you sort of as a nurse to be able to access AIR. I'll send that link in the follow-up email. It's an IM004 form at Services Australia, but I'll put that in the follow-up. So topics that we still need to talk about, recalls, contact notes, reminders, and then the whole sort of data quality and data cleansing, which we've sort of touched a little bit on as we've gone through, but there are some other bits and pieces that I'd like to go through as well. Let's talk recalls first. And I guess just to come back in here a little bit, where documents and things would potentially be stored, and then we'll talk about the actual result itself. So you do have obviously correspondence in is incoming documentation. Correspondence out is essentially anything that we create from the word processor. And see, we've got my little care plan here that's currently in a draft mode. So I could double click on that and go back and finish it off. Or any of those other documents. And even in here, any of these, you can double click on to actually go back in and have a read of what they are. Investigation reports is where those results do come back to. And I mean, not that we really have to do too much in here, but these are the results that also we will see in the follow-up inbox, which is what we're going to have a look at shortly when we have a look at organising recall appointments. You do also just have clinical images as well. So if you're taking any photos of, like a skin check or something, you can always come in here and add that image in, give it some, detail around whatever it is so we know for next time. And again, any of these you can double click on and it'll load up that photo if you need them. So you've got sort of all those little bits of where it stores documents and pictures. Let's talk results. So obviously, and which will lead us into recalls. What the doctors will do is obviously they'll send a request for pathology or imaging when they see a patient. The patient goes and gets that test done. That result then comes back into the software. And just so we can get a bit of a visual as to where we then pick it up to organise the recall appointments, is the doctors will have their own investigations inbox, which is on the main screen, the little paper tray with the green arrow. They will have their results in here. It does group it by the patients alphabetically. It does try and color code it appropriately, which can be successful. Green, obviously, it's come back in a format that the software knows is okay. Red is that there's something that's not okay with that. So in this case, it's that these results are outside of the acceptable ranges. The yellow ones are more either like a warning, like a yellow traffic light, where they're close to being outside of that acceptable range, or it's like a full-blown imaging report where, I mean, the software is nowhere near smart enough to read and comprehend whether that report is, green or red, essentially. So it just puts it as yellow. What the doctors will do in here is obviously they'll have a look at whichever result that they want to check. The results in the middle there, they'll have a read. There is this little comment field over here, which depends on your practice, it can be used, and it can be used for the doctors to leave us a little bit of a note as to what sort of they want us to do. So for example, they might need a long appointment to discuss that particular result. So they could leave us that little comment, which we can see from our follow-up inbox when we get there. Action to be taken is really the crux of the whole thing, is the providers or the doctors need to be making sure that they fill this in, because that is what will flow through to the next step, which is when we pick it up to organise some recall appointments. So they might say, look, let's just say an urgent appointment. They will obviously go and do, they might just keep going through, they'll do extra things. Where that result goes to from here. So at the moment, this is the only place that that result is sitting in until they action it. When they action it, it then splits into two separate places that we can find the result. One is it will now show up in the investigation reports back in the clinical record, but also it will now show up in our follow-up inbox for us to get these patients back for their recall. So the follow-up inbox is the little blonde person with the mobile phone in here, which it can look a little bit daunting in here. And it definitely took me a while to get my head around what is happening in here. This is all of the results that have been checked in the software. And depending on what filters you choose up the top here, depends on what you actually see. But ultimately, you can see all of the results, even results that have been given back to patients. They're all sort of in here. It's just that we typically aren't interested in filtering for them because that's not what we need to be doing. You've got some dates up the top here. The action is that action that they chose, or the doctor or the provider chose back on when they check the results, so that little right-hand side. And that's why it's a mandatory field that they fill that in, because it kind of flows through to here. So all unaction just means everything that hasn't been touched essentially yet. So you might use that list, or maybe, because you've got heaps in there, maybe you go, okay, well, I just want to have a look at the ones that have been marked as urgent, and I'll prioritize those ones first, and then I'll go back to the other ones. Also, as a side note, these names are all hard coded in the software, so they can't be changed, or customized to mean different things. And what you'll find at your practice is that there'll just be some understanding as to which ones that you use. So again, that workflow will just be a little bit different everywhere essentially. But make it mean whatever you need it to mean. I'll leave that as urgent. Filter by status is then saying, okay, what status are we looking for? Sent is a little bit of an older status now. It was originally, if we were to send them a text message using BP Comms through the software, it would mark it as sent, that we've sent them that text. Whereas now there's actually a little configuration where if we send them a text message, it will just mark it as contacted instead of sent. So that is a configuration. So you may have ones in sent, but hopefully most of them should just be contacted now. But nil status hasn't been touched. Contacted means that we have marked it as contacted, in which case we should have also recorded a contact note with it. So these attempts should at least be one phone call, one message, one something that we've tried to contact them. Beyond that, just going back to, we can always see the given ones as well if you needed to. They are all in here just depending on what filters you're looking for. So there's that result there that we just processed if we put our doctor hat on for a second. So you've got the action that they chose, so urgent, and then there's that little comment that they wrote in that comment field. So you can use that again as a little bit of communication between the two. Your options in here to get that patient back for that recall appointment. It does give you all their phone numbers in here, so potentially we could be calling them and trying to get that appointment over the phone. You do have sort of a few options. I mean, there's heaps of buttons up here. First one though, let's have a look at, is recording a contact note. So say I did call Bonnie. It does give me all that information up the top here. It knows that we're calling about a result because we're initiating that contact from here. Contact method, maybe I called. Who did I contact? Was it the patient? Was it maybe their next of kin or something? I'll just leave it there. Defaults to today's date. You can backdate it if you need to. And I'm just going to say left voicemail, booking recall appointment at, I don't know, 10:30 a.m. Whatever note that you need to put in there. When you are recording contact notes, you do need to give it a status. So whether it's successful or not successful, I'm going to say, oh, actually I left a voicemail. I'm going to say unsuccessful, and I'll save that one. So it gives me an extra attempt. It's a red phone because I said it was an unsuccessful contact and I said that I called them instead. There's a few little legend things down here that will sort of help you read that. But just because I put a contact note in does not automatically mark it as contacted. I would then still need to say, yes, I've at least tried to contact them once. In which case it disappears from this little view because I'm purely looking at things that haven't been touched, but I would then be able to pick it up again in that contacted list and in time do something else with that particular result. If that's something that you can do at your practice, you can mark results as given by here. Maybe if the doctors have said that it's an okay result, there's nothing that needs to be done and they're happy for us to communicate that if that's a thing, you can mark them as given from here. You can send them a text message. Again, if you have BP Comms set up and the patient has consent recorded in their demographic, you can send them a text message. You would probably find if you are, or if you do have that ability, that there will also be some template to use, so you don't sort of get to change it, that you would just sort of be sending them a message from there. You can view that particular patient's appointments that they already have booked. So I've got, well, Bonnie's technically sitting in the waiting room already at my practice, but you'd be able to see if they do have any upcoming appointments through there. You can also make an appointment from this screen, which is helpful. So say we call her mobile, we do get a hold of her now, we can actually go ahead and make her booking without even having to go back to the appointment book. We can just kind of do it all from here. So you've got the date that you choose, you've got the provider, which will default to the provider that checked the result, which usually would be the right one. Their available times according to their schedule or according to their appointment book. So I'll just pick that one. It does default to that recall appointment type, which is important because it is a higher level of permission in the appointment book to cancel those appointments, because obviously there's the legal requirement to give patients back their results. But also from the doctor's perspective, when we book a recall appointment and they open up for the consult, so back in that clinical screen, up the top in that notification section, it actually tells them that this is a recall appointment. It puts it in like a yellow background with red writing so it really stands out, so that then they know that there's some form of result that they need to be talking to that patient about. So it's got a couple of good reasons why it sort of puts it in as a recall appointment. If it's like a long appointment, like this one that we've been asked, obviously we can change that if you need to. You could put, a detail in there if you wanted to, but otherwise we can just save it and it'll book that appointment. That's just whinging at me because he's out of office then after that. You can also add clinical reminders from here if you needed to. So it opens up the reminders for that patient and you can go ahead and click on new like we did earlier. Other things in here potentially, if, and this is probably just a bit of a helpful thing, if say a doctor has marked a result as given accidentally, like it wasn't a result that they actually talked to them about, when you find that result in here, remember you just have to go and find it in the given status, you can actually go and unmark that result, which just reverts it back to that it hasn't been given to them yet. There is also the option here that you can do a mail merge. I'll just change that back to these ones just so I have a few more. So we can go file, mail merge. And what you can do is maybe not so much a letter, or when you are at that point of having to send a letter, you can do that. But if those patients have got consent for SMS, you again would have that SMS template. So it would then go and send that message to all 9 of them without you having to kind of manually do it. So if that can sort of help your workflow, you've got that option as well. I'm not going to send 9 text messages though. All of those are just the same as the buttons up the top. Typically the buttons would probably be easy to have a look at. But that's pretty much the recall workflow. There is a whole sort of webinar on it. I'll put that link in the follow-up email as well if you want to have a bit of a look at that. So I think it goes for about half an hour or so. By all means, I'll send you a link if you get a chance. You can have a look at that. Reminders. So reminders as far as sending them from the software. So if you don't have like an online booking system that kind of automatically does it for you, and you are sort of sending them through Best Practice, just come up to Clinical and you've got reminders here. And first off, we just need to go and select the reminders that we're wanting to send. So we select some patients, choose whichever one of these or all of them that you're potentially wanting to send. I don't have a lot of data in my training database, so I'm just going to pick a few through there. The due date. So this is going to pick up these 4 reminders for all of the patients if that reminder is due within this date range. So you probably want that to be maybe a bit more in the future. So you could do it for, the next month or whatever you need it to be through there. You've got your users that you can select. You've got locations as well. If you've got a multi-location practice, just select the relevant one through there. Oh, that was terrible. Why do I not have any? It's because they're all next week, I think. I'm just going to select all. I've got to have something in here. There we go. So it will then go and find all of those reminders that are due in that date period for that list that you selected. From here, you would send those reminders, which is kind of like doing another mail merge. You've got some that will be sent or printed a letter. Some who have their consent for SMS, for clinical reminders, they'll get an SMS message. And then I've got a few that have got the app, so they'll get it through the app. BP comms, though, will be the text message ones. So again, you should have a template already, but this is the message that they're going to get with the little pre-filled information. You would also choose a letter, and there is a default reminder letter in the word processor templates. What am I looking for? Reminder. There we go. But by all means, you can edit those templates to be, if you want it to be different wording or something like that. Pretty much then over here, we would just click on send. I'm just gonna untick those and just see if it'll send a few messages for me. Just because I don't want to print to PDF those, 10 or so letters, that's all. So it's gone and sent those reminders. All these ones are still sitting here because we haven't sent the reminder because I turned off the letter. But typically this would all sort of disappear. Rinse and repeat that down the track if you need to then send different reminders for different dates and things like that. You also up here though have your follow-up reminders. So in here, again, it looks a little bit daunting, but it's all just to do with what filters are up the top here. So, sent on or after particular dates, ones that have been unactioned, if you just want a particular provider, things like that. Just get that list to be what you want it to be. And then you do have a few options over here to choose from. So you can actually, if we got them on the phone, we could book them an appointment from here. We can go and access their contact notes if we want to record a note in there. You can also, if you had to, mark it as performed, as in the reminder as performed. As well as if that reminder is no longer required, you could do those two things from here. You probably wouldn't, where typically you would do those two things. And again, this is more of a doctor thing, but it will impact those reminders that you're sending. So up in here in this notifications, reminders get seen only if they're coming up in the next 30 days, they'll be in blue, or if they're overdue, they're in red. Hopefully what the doctors are doing either through here or even through the full big long list of reminders is either when they right click on it is either marking it as performed if that's something that they do as part of their consult, or if they're marking it as no longer required. So they have those options when they right click on it up there. That's really crucial, again, from a data perspective, because if they're not doing that, those reminders will still sit there. And when we go and process all of these things to send them out, those reminders, these patients are still going to get reminders for things that they've either already had done or they don't need to do anymore, which can potentially be frustrating for them. That's reminders pretty much. But again, I will send you that webinar that goes through recalls and reminders. That's the whole sort of webinar that you can sort of watch as well. That sort of covers it all again as well. And you'll also have this recording up out of here. I am just a little bit conscious of time. Let's talk data quality and data cleansing. So we talked a little bit before around, again, more so the doctors, when they're putting in diagnosis to actually make sure that they find something in the list and they double click on it and they don't touch that field. They write their sort of extra notes through here or use some tick boxes. Where that's important is that there's an actual little tool that we can then use to go and clean up that data if they have sort of edited that field. Where that is, and it does get installed automatically with the software, but there's a separate little app that's called BP Utilities, which is, it's a similar concept to like the bulk document importer. If you've ever used that, it's a separate app that does just get installed as part of the package. BP Utilities, it is a permission-based thing, so obviously your practice manager would need to give you access into here. You can do a little bit of damage in here. So I'm only going to show you one thing, which is purely to clean up those uncoded items. If though afterwards, you get this job to do it and you're not 100% sure, please just call support to sort of, I guess, hold your hand through it the first time, just to make sure that everything's all good. Because yeah, you can potentially do a little bit of damage in here if you kind of venture too far off the beaten track. The one thing in here though that we're going to look at is this cleanup history. So like the little paintbrush icon. I'll double click on that. So this list, and if this is not something that you've done before, the first time you come in here, be prepared because it could be quite a lengthy list. But what it is any of those diagnoses that have not just been double clicked on, where the doctors have actually gone and typed extra things in that field, they will show up in here. And all we need to do is select the one that we want to fix up or we want to change back to being the coded item. And then over here on the right-hand side, search for whatever that is. Oops, if I could type properly. So let's say that should be this one, if that was, obviously what we matched it up to. So select what it should be, replace it. It then removes it off the list over here. And that's all you need to do is sort of rinse and repeat that process until this list is empty, because then that means that everything is clinically coded, which is what we want. From a data extraction point of view, but also from like a reporting and a point of view, which we'll have a look at when we get to the database search in a minute. Wryneck, I think, is just a typo. Again, find it, replace it, rinse and repeat until that list is empty. I'll hop out of here. That's the only thing that we need to sort of worry about in here from a data perspective. Yep, Heidi, how do you get to here? You just need to do a search in Windows, so the little Windows icon, and type BP Utilities and put your password in again. It's the same as your normal BP password. And then just scroll down and you've got cleanup history there. The other thing I wanted to show you was the database search. So up in utilities on the main screen, there is, it's not called database search, it's just called search, but it's the same thing. This is really powerful as far as what data you can get out of here that will potentially help you. Yep, Stephanie, I can do that for you. Hold that thought. So by default, this is showing us all of the patients that are just active in my database. So over here on the right, I need to run the query. It does look a little bit daunting up here. It is the language that the database is written in, which is obviously a bit of like a pseudo-Englishy type thing. You are by no means expected to learn how to program to be able to use this screen. You do have all these buttons up the top. So say if you were looking for all of your active patients that have a condition of asthma, find what you're looking for, double click on it. I don't know if I should have someone, here we go. And then run the query again. So now these are my active patients who have asthma, essentially. There are also, I mean, you can create your own through here. There's a bit from the demographics if you're looking at people's ages and stuff like that, or you want a list of all your patients in a particular postcode, stuff like that. But there's also a whole heap of queries that are supplied for you, and you can just load them. They are in the program file folder, sorry, for BP, which you're not expected to remember. I'll put all this in the follow-up email. But supplied queries, it breaks it down into those four, so clinical, demographic, management, and visits. I'm just going to find the one that I want for your question, Stephanie, which I can never find it when I'm actually looking for it. There we go. So Stephanie asked, can we have a look at how to do a query for bulk inactivation if patients haven't visited the practice for 2 years or longer? Obviously a good one for accreditation. when you load a query, in that demographic folder is this one here. It says active patients who have not had a visit in the last 12 months, but we can change that to 24 months. And they have no future appointments, so they're not coming back. And they're also not a relatively newly created patient, so they're not made in the last 6 months. That's the criteria for that query. So I can find it, I can load it, I can run it. And as far as changing it to be that 24-month period instead of 12, it's this number here that you would change. So that's how many months that they haven't been here for. I don't know. Oh, I've got some. There we go. So I've got some in my database that are still sitting as active patients, but they have not come and seen us for 2 years. So it's probably safe to mark them as inactive. What you can actually even do from this screen here is you can come up to File and you can mark this list of patients as inactive using that option there. It just says that all the patients in the list will be marked as inactive. Are you sure? You would say yes. I am just going to select no because I don't have that many patients left to work with. And it would then say, X number of patients have now been marked as inactive. So that's that process. Other things as well, though, that you can do because there's lots of stuff, and even in that clinical one, there's lots of queries that are already supplied for you, that even if it's not exactly what you want, you can use it as a bit of a base, and just have a bit of a read through and have a play, or you can, kind of create your own as well. But there's heaps of stuff. I would definitely, if you haven't been in here and had a look, definitely come and have a look to see if there's ones that you could potentially use. When you do run queries as well, with this list that you generate, you could also do like a mail merge. So say if you ran a query for all the patients that have diabetes because you have a diabetes educator starting next month, you would run that query, get that list of your patients, do a mail merge. You could then have like a letter that you've created in your word processor, that basically says, come along, book in, blah, blah, blah from there. And we could then send or print that letter to send to them. Or again, if they've given us SMS consent, we could have a little BP comms template that says whatever that message is, that we could also send out, and it would record that contact as a contact note as well. So you can do some cool things in here to try and be more proactive with, patients of certain ages that may not have had health assessments done, all that sort of stuff. You can do some really cool stuff. I will send you a bit more info about it, because you could easily lose yourself for a few hours in here having a bit of a play. I am conscious of time. There's probably just one other little area just to super briefly point out that may be helpful, from sort of that data point of view. There's a couple of reports. So in management, you've got reports. You do need to get given access to them. So if you come in here and you can't see any reports, it's just that you haven't been given access to them. And even if you can't see reports in this management menu, it's again just that you haven't been given permission for it. So you can ask your practice manager for that. I have all the reports in here, which I'm not going to go through all of them because a lot of them is not really for us, but just a couple that I wanted to show you, or at least that they exist. There are a few patient reports in here, which could be helpful. Some patients without a date of birth, without a Medicare number, grouping them by their postcode, things like that. This is okay if you are purely just wanting a report format, so you don't need to kind of do anything with that data, or maybe you want to export it to Excel or something. But these reports are static, so what information you get is what you get, whereas that database search, you do have the option that you can put some extra filters in it, to sort of show you some other little bits and pieces as well. There's a few patient reports in there you may want to run. The other one just in here, actually there's two more that I'll quickly show you. One is the shared health summaries as far as the number that's been uploaded. Good just to see how you're tracking as far as PIP for the quarter. I don't have any data because I can't upload in my training environment. But when you run it, if you run this one uploaded by provider, it will show you a list of your providers and it will tell you how many individually that they have uploaded for their patients of their shared health summaries. It gives you a total. So, if you need to get 500 and you're sitting at 400 and, you've got a week to go, maybe you can start chasing up some people to do some uploads, but that just lets you see where you're at. And then the last one in here is a total vaccines provided, which you could run historically. And again, it just shows you how many vaccines have been given in a particular period of time. And any of those reports that you run, you get to choose the date range that you're looking at. So in here, you've got those, start and end dates. So it could be for the quarter, whatever it might be. You could do last flu season to see how many, vaccines you gave, things like that. That's another good one just to either from a, making sure that your stock take is right, or even from a, we did 200 last year in flu season, so I'm going to order 200 for this flu season, things like that. Angel, I did see your note. Just hold that thought for a second. Sorry, one more thing, and then I'll wrap it up. We could be here for more time. There's so many things to show. But one last thing, in the view menu, you do have your incoming reports. And the only reason that I show you this is, so this is going back to those results that show up in the doctor's inboxes for them to check, and therefore for us to organise recall appointments. Sometimes results come back into the software and they're not allocated to a patient, and or they're not allocated to a provider to be checked. So they kind of sit in a little bit of limbo land. That's where this screen comes in. So incoming reports, it was just under view, incoming reports. Basically, this will show us all of the results in here that, potentially, well, actually, sorry, this shows us all of the results that have been imported into the software. The only ones really that we would care about making sure our data is good is that we would show our unallocated ones only. So these are results that are sitting in limbo. They're not assigned to a patient. They're not assigned to a provider, which means they're not going to get checked, which is the big thing. All you need to do in here, you can double click on it and you can have a read and so, yeah, it's that patient, it's that provider, perfect. Right click on it and allocate it to a patient. Do a search for, I'm just going to put it in Bonnie's stuff. Find the patient here, double click on it. It's now allocated to that patient. It's still in the list though of this unallocated because it's also not allocated to a provider. So in here, we can right click, allocate it to a user. This is saying it was addressed to Andrew Atherton. We don't have an Andrew Atherton. Who do you want to allocate this report to? Let's say Dr. Fine, that's who I'm logged in with. You can also make it a permanent alias. So say this was an old provider that's no longer here, but potentially there's a few trickling reports that will come back. What you can also do is put that in as a permanent alias. So going forward, if there's any reports that we receive for Andrew Atherton, it's automatically going to assign it to Dr. Find a Cure here, which will save you time down the track. So I'll save that one. Because that result's now allocated to a patient and to a provider, it's no longer in this list and it will show up in their inbox and they can check the result, and it just falls back into that same workflow that we looked at earlier. Just your message, Angel, around, would you show again how to create a shortcut for progress notes? Absolutely. Just back in here, you just want to come into autofill and click on add whatever message that you want. Remember, the up arrow, the one above the 6, is a placeholder, but beyond that, just type whatever you need it to say. Give it a shortcut key. Make sure it's probably not a word that you would regularly type, or put like a symbol or something next to it. And if you want it to be available for other people to use, just tick that or not tick that. I'll just have a quick look back at the questions. I think I answered all of the questions as we went through. Just having a quick look back now. I think I answered all the questions that people put through. So that's pretty much me. Thanks everyone for hanging out for a couple hours. Hopefully you took something away from that session. There's heaps in there. The session was recorded. We'll get you a link to that. There's a few follow-up things as well that I'll send through as well that can be helpful. And I will double check. I think it was for you, Stephanie, asked the question around the medical contraindications if nurses can add them as well as doctors. I'll double check that. I'll get a final answer for you on that one. But other than that, if anyone else has got any last minute questions, please put them in the chat now. I'll stay here for a little bit just to see if there's any last minute questions. But beyond that, thanks everyone for taking the time out of your busy day to attend. And yeah, hopefully you got something out of the session. But I'll hang out here just for a little bit longer. If you've got any questions, please put them in the chat and I'll try and answer them before I go. But otherwise, yeah, have a lovely rest of your afternoon. Thank you very much. Just reading your question there, Nisha, are we able to add the medication list to the patient's profile for new patients? I mean, it's a good question whether you could go and actually add them in here, but typically they would just be added as a document, whether you put them in correspondence in as sort of their medication list from there. Ping, yes, the session's definitely recorded, so you can go back and watch the start. Mary Jane, CPD hours, that's a very good question. I might revert that back to Barb at Eastern Melbourne PHN. She might be able to answer that one for you. I'll find an answer for you, but maybe just double check with those guys. Yeah, perfect. It's always good to get your hours accounted. And yes, Ping, the doctor session was also recorded. If you reach out to Eastern Melbourne PHN, they'll be able to get you a link to the recording as well. All the sessions are recorded, so we can go back and rewatch them. We'll wait for the application so we can access view. Yeah, it'll be life changing, I think, for you, Mary Jane, if you can get in there. But yeah, I'll send through the link. If you're super keen, it is an IM004 form. Just Google it. It takes you to the Services Australia website. It's a document. Fill it in, send it to them, and then it's just a matter of copying that code that they give you into the practice details in the setup menu. But I will put that in the follow-up. But if you're super keen, yeah, just Google IM004. Perfect. All right. Well, it looks like all the questions are drying up, so I might leave you to it. So yeah, have a lovely rest of your afternoon, and thanks very much for joining our session. Thank you.